Welcome to the Natural Health Podcast, where we bring awareness of sustainable health in a business hustle space. Natural Health Podcast is perfect for the high-performing, business-minded individuals who want to work with their biochemistry to achieve success and optimal health. It's Friday, which means it's time for French strength facts about health, business, and overall success. In today's episode, we welcome back Dr. Aaron Hartman. Dr. Hartman helps patients identify leverage points in key areas of their lives and health that harness their body's remarkable power to heal and begin living the vibrant life that they deserve. He has become the go-to doctor for difficult heart cases in Central Virginia. As a clinician researcher, Dr. Hartman has been involved with over 60 clinical studies. He's the founder of the Virginia Research Center and currently serving as an assistant clinical professor for family medicine at the VCU School of Medicine. And in 2016, he founded Richmond Integrative and Functional Medicine. And he was also been featured on a Natural Health podcast on episode 309, where we spoke about half of all chronic diseases are directly related to eating processed foods. Welcome to the Natural Health Podcast. Well, welcome back to the Natural Health Podcast, Aaron.
It's great to be back. And we've already had a great conversation talking about headaches and migraines. And I love talking about because it's something I personally suffered with from childhood. And there's so many things you can do about it. So I'm excited just to share things with your community.
I'm so excited, and I thought let's just get straight into it. If anyone wants to get to know you a little bit more, they can listen to the past episode that you've released where we spoke a little bit about what you do, why you do it, and so forth. But today we're just going to get straight into it. Let's talk about migraines, food, supplement, and lifestyle hacks to literally say goodbye to our migraines. So give us a little bit more about your experience with migraines.
Well, migraines, when you think about migraines, one of the things is many times people don't realize their regular headache is a type of migraine. And so there's two migraine centers. One is the V2, which is a part of your trigeminal nerve, which is right in your sinuses. So a lot of people's sinus headaches, it's actually a migraine variant. I get these headaches when the weather changes, the temperature changes. Is it really allergy or is it actually your migraine? The second center is your C2, which is in the back of your head. It's the neck pain radiates here. So personally, when I get headaches, I know which ones are severe and not. If mine start with an aura, like a visual thing, I know it's a severe one. It's probably originating in my V2. If it's more of a neck pain in the back here, it tends to be less severe personally. And so that's the first thing. That's where the migraines start. But ultimately, everybody can get a migraine if you hit their head hard enough, right? Everybody can get a headache if you hit them hard enough, right? And so based on your headache threshold, some people actually, did you know, some people don't get headaches? It's kind of frustrating, to be honest with you. And so they have a really high, I know, right? Really high threshold. And so one of the ways of knowing that, if you drink something really cold, really fast, and you get that brain freeze, then you're someone who can get headaches, right? There are people who actually don't get headaches when they do that. There's people actually don't get headaches when they do that, right?
And I can imagine people just testing and being like, oh, I'm just going to get a cold drink and try it.
I mean, I guess if you did it long enough and hard enough, you could, freeze your esophagus or whatever. But point being is everybody's got a different threshold. And if you have a very low threshold, then food, environment, chemicals, all these things might be triggers for you. And that's where kind of getting a feel for your headaches, how sensitive are you, hormonal changes, if you're a female going menstrual migraines, if you're, sleep stress, all these kind of things can play into it. Figuring out what that threshold is, bumping it up, and figuring out if there's triggers that are lowering it, nutrient deficiencies, and a whole host of things. And so that's part of the journey with someone, figuring out what their triggers are, what can lower, increase that threshold, and then giving them options based on the kind of headaches they have.
That's so interesting that you've spoken about pain threshold, and we're going to talk about that a bit later on. But are you able to give us maybe a one-on-one on migraines? You kind of told us two starting points for most people with the V2 and the C2 of migraines. But what are actual migraines? What's the difference between a headache and a migraine, and how does someone know?
Well, a headache actually is this neuroinflammatory process in your brain. There's this thing called the spreading depression of Leal. So initially starts as vasoconstriction. So these vessels constrict, and that's the aura phase. That's your vision's off, hearing's off, the flashing lights, weird smells. And so it's basically decreased blood flow to a certain part of your brain. And if you watch this spreading depression of Leal, it actually is almost like a wave that goes across your brain. And so the second phase of the migraine is when you get vasodilation and increased blood flow. And that's when all of a sudden now you feel the pulsing headache, right? The pain nerves around those vessels are activated as the vessels open. And now you actually feel your pulse in your temple, you feel it in your head. And so the thing about the migraine, if you catch it on the front end, on the vasoconstriction end, you can actually prevent the full-blown inflammation. Okay. The other thing about migraines is because it's this process, if you inappropriately treat it, like with narcotics, we talked about Demerol, meperidine. I'm not sure what the Australian equivalent of that is, but it's a narcotic. It's like putting a blanket over this burning neuroinflammation. Well, if you pull the blanket off while the inflammation is still going on, you can have a flare of your migraines. And that's what happens a lot of times. People use the wrong kind of medications to suppress this. They don't address the neural inflammation. They have these flares and they can almost spiral out of control. That's also where some of the medications get tricky because you can actually have rebound headaches. So you take lots of Tylenol, ibuprofen, Furosip, butalbital, all these typical things for your headache every other week. Now it's every week. Now it's 3 times a week. And you actually develop withdrawal headaches. And so you actually create a different monster because you're covering the inflammation, not addressing it. And those ones it's unfortunate because those ones you literally just have to pull the blanket off, burn through it. But that's also, we mentioned steroids like steroids like Demerol, which is dexamethasone, how you can use those to quell that. And I'll use that sometimes acutely when I'm getting people off of drugs to get them to a better place. But it's ultimately a neuroinflammatory condition related to vasoconstriction and dilation that results in the pounding, miserable headache. And then because of its relationship with the vagal nerve, people get nausea, GI upset. Kids, actually, interestingly enough, can have abdominal migraines. Their migraines don't start in their head, they start in their gut. So they get stomach pain, nausea, and it's actually a kiddie migraine. Maybe colic is some version of this. Of course, we can't ask 2-month-olds, any other symptoms, but it's really interesting. There's also a correlation between your gut and your brain with migraines as well. So, if you've got IBS, SIBO, gut issues, food sensitivities, really bad leaky gut, I've learned this in the last couple of weeks. I've learned this new term, actually from the 1950s, called autointoxication, which is this old German concept of basically what we'd call leaky gut, postprandial notoxemia. You eat foods and the toxins get across. They knew about in the 50s in Vienna. So a lot of things we're going to talk about today actually are older concepts, but I'm actually learning how to reinterpret them with some of the newer science. So.
Yeah, I love that you explained that to us because a lot of people get confused with the initial migraines, the constriction and the vasodilation. So like, which one is it? And it's like, it's both. And it depends what's happening. Are you able to give us, what is the usual treatment? Like if someone has a migraine, they go to the doctor, what's the usual treatment that they would receive? I mean, I know you mentioned a few of them, but what would be actually the steps that they would go through?
Well, typically the standard of care model would be, how often is your headache? If you have 4 to 6 times a month, usually you just get a abortifacient, or it's something that aborts the migraine. And that's your triptan, your Imitrex, your Maxalt, your rizotriptan, those triptans. And they work really well for the abortion of those acute, if you catch it on the front part of things. If you have, maybe your job is you have something where you can't miss any days out because, 4 miserable days you're not working is not acceptable to you. Then you go to preventive stuff. If you have more than those 4 to 6 acute headaches a month, then you go to prevention. That's where you use a whole host of things, certain seizure medications like Topamax, certain blood pressure medications like calcium channel blockers, propranolol, tricyclic antidepressants like amitriptyline, certain antidepressants like Cymbalta. But if you hear what I'm saying, I'm saying antidepressants, blood pressure medications, seizure medications. Like what's the correlation? And the correlation is a lot of these medications actually are neural anti-inflammatories that affect the vasculature. So you'll take these every day to prevent the headaches, and then take the aborting kind of medications if you got the flare. And that's the standard way to do it. There's a whole host of medications you can do, and that works actually pretty well for 50+% of people, but it doesn't address that whole neuroinflammation, the sensitivities, the migraine threshold I was talking about. Those things don't address that.
I love that you explained that to us. So you mentioned the GI tract, right? As one of the major migraine centers of the body. Diet and food triggers are huge. Are you able to go a little bit more into detail? I know that you said we knew that in 1950, if not even before, when it wasn't even written. So what is the link between you've mentioned about if someone goes to the doctors, they get a bunch of medications and it's like off you go. But what is the link with the GI tract and food and migraines?
Well, your vagal nerve, which is one of your cranial nerves, it touches all of your internal organs, your heart, your gut, your spleen, liver. Most of the attachments are your small bowel and your colon. And 90% of the communication of this vagal nerve is from your gut to your brain, not your brain to your gut. So what we've learned in the last 10 years is actually Parkinson's starts in your gut 20 years before diagnosis. Alzheimer's starts in your gut 10 to 20 years before diagnosis. So it makes sense that something like migraines, maybe a significant portion of those are this gut-brain inflammatory process. And that's the case actually with certain foods. The big ones we know, we have a lot of data on are gluten, for example. There's a whole host of data on gluten-induced migraines. There's actually a thing called gluten-induced cerebellar ataxia, where kids eat bread and get dizzy. So a lot of your sensory kids that have like sensory tactile issues, they kind of crave their dairy and their gluten. Well, and they see kind of often, actually it's bread-induced dizziness, right? And so there's certain specific things like that, but then there's also food chemicals. There's red dyes. MSG is a classic neuroinflammatory. I mean, monosodium glutamate is a neurotoxicant. It's a food enhancer, flavor enhancer that's in all your a lot of foods and a lot of Chinese foods and other things. And certain coffee manufacturers actually put on their coffee as a flavor enhancer.
Wow. In their coffee. Exactly. I've seen it everywhere, but I haven't seen it in coffee before. That's interesting.
Yeah. Well, I mean, there's a particular brand. Well, Starbucks actually, I guess I can say that. Starbucks actually uses it as a flavor enhancer. And so personally now I can't drink it because it gives me reflux,
Oh my gosh.
For other reasons. So it's really, I just kind of source all my own stuff, for this reason, but that's where food comes into play. It's like, how do you ferret out, MSG versus gluten versus even dairy for some people. And that's where like elimination diets, that's where we're doing some kind of, removal of inflammatory foods. Some people in nightshades, potatoes, tomatoes, eggplant, and it's interesting. I don't know if you've experienced this or not, but I didn't realize ashwagandha was a nightshade. And one of the patients actually educated me about that because it made her feel terrible. And she researched it and she's like, oh, it's actually a nightshade. And I was like, what? Oh man. So it's really interesting. Even things like that, you think you're helping people if they have a nightshade issue, could potentially trigger migraines.
Yeah, it's a deep, deep hole. And even going back to MSG, I did a podcast, it has so many different names. Like they don't put MSG anymore. It's yeast extract. It's a number. It doesn't even say MSG. Flavor enhancer. Like it doesn't most of the things that you look at now does not say MSG. Yeah. And the reason is because it got such a bad name.
Yeah. Well, natural flavor, at least in the United States, natural flavoring means nothing. You can have, it's a legal term. That means it tastes natural, but it's 60, 80 plus chemicals. And I assume you might have a little MSG in there as well.
That's absolutely crazy. And there's things like tyramine, nitrates, histamines even. Histamines, I guess, would be a huge one because I know that people who have migraines or headaches, one of the questions I ask them is, do you eat leftover food? Because they cook. They're like, I'm so healthy. I cook my own food. And I'm like, okay, so what do you do? They put it in the fridge and then it increases the histamines and then that's when they get their headaches, even though they're eating something healthy.
Well, it's interesting you say that because one of the things when there's a lot, you develop cocktails, and like in my clinic, if you come in and I can individualize your cocktail for your acute migraine, and it might be a whole host of things, but many patients actually do well with shots of antihistamines like Phenergan or Benadryl. And it's kind of interesting because one of the over-the-counter cocktails I'll do for at home for people if they're doing medications is like Benadryl with like aspirin, ibuprofen, and caffeine, and a little Tylenol if you feel your headache coming on to break it. But the antihistamines actually, to your point, histamine foods can cause it. Antihistamines are actually part of some of the acute treatments for severe migraines.
Yeah, so there's different way to handle it. I guess depends on the individual, what's happening.
Yeah.
So let's talk a little bit about the pain threshold that you mentioned. So what is it and how are people able to, I guess, lower their pain and migraine threshold? Or is that even possible?
Well, I mean, it is. Well, for example, I think about the pain threshold just like a seizure threshold. if I sleep deprive you for about 2 weeks, this is one of the ways we diagnose seizures, right? Is overnight EEG, sleep deprived. You don't sleep overnight, your seizure threshold is lowered, and you can pick up people with brainwave activity like seizures. So disturbed sleep. Sleep apnea is something that a lot of people have, mild sleep apnea. There's a thing I call skinny people's sleep apnea. And it's basically your athletic people who are double jointed, hypermobile, have narrow airway passages, their face is a little elongated, double jointed, et cetera. But they have this upper airway resistance syndrome. So they might have mild sleep apnea, but that can increase your cortisol and lower your headache threshold. Chronic stress, chronic elevated cortisol levels, increase leaky gut, right? And I mentioned that whole auto intoxication, which involves around your gut bacteria. Now the chronic stress is increasing toxins leaking across your gut, right? And so there's a whole host of things like that. Even the environment, one of the things with seizures as well as neurological issues, PANDAS, PANS, is actually mold in the environment. It's really interesting. In Australia, you think Australia, there's no mold there. Actually, it's a huge. In my group, my shoemaker group, there's a whole Australian contingency. And I remember looking at one of the houses, and it was literally the inside was it's like someone took spackle everywhere, but it was mold. And it's like, and you think about, again, I've never been to Australia, but evidently it's a big thing there as well. And having that in your home can lower your headache threshold.
Yeah, the more north you go, the more mold there is. But it's interesting because when you go to renting, a lot of places have mold in the bathrooms, and I'm like, this is not normal. Why? Oh, don't worry, we'll just paint over it. And I'm like, no, we don't just paint over mold. But you're right. So, individuals that are listening now, they're like, okay, cool. Mold can trigger my migraines. Food can trigger my migraines. Stress, sleep deprivation, any type of inflammation, which is kind of what you're hitting at. Is that right?
Correct. Absolutely. I mean, again, I said this is a kind of neural inflammation. It's really interesting, the idea of inflammation. It's like, okay, you have inflammation in your joints. I call that rheumatoid arthritis. If it's in your thyroid, I call it Hashimoto's. If it's in your gut, I call it inflammatory bowel disease. Our genes are different, our environments are different, but inflammation is a common thread across aging. As you age, you get more inflamed. Things like a SED rate and ESR. If you're a female, in your age range, you want the SED rate less than 15 or so. A SED rate of 40 or 50 when you're 60 is considered normal, right? And so it's like, as we age, we get more inflamed. And so how do you live a lifestyle, stress-wise, diet-wise, supplement-wise, that helps mitigate that natural tendency to get more inflamed as you get older?
Yeah, 100%. I mean, they've even, I read a bit of I think it was a study or in a book, and it said that people, after they go to the dentist and they get their teeth taken out for like a week or 2 weeks, they're depressed. And it's like, that's inflammation that's whole body inflammation, but it's also inflammation in the brain. They get depressed after a surgery.
Well, the mouth is actually a source. So like you may have someone with crazy diabetes, dementia, chronic headaches, and they got perioral disease, bleeding gums, they make lots of tartar. And there's so many things you can do to actually lower bacteria counts in your mouth by alkalinizing your secretions in your mouth, by using oral pulling to basically dissolve the bacterial membranes. Spirochetes, Lyme disease, syphilis, or spirochetes. Porphyromonas gingivalis is a spirochete that we all have in our mouth. That's what causes gingivitis. And so, to your point, dental extractions. But I've actually had patients with small abscesses, get them addressed, and all of a sudden they're fibro flares, they're chronic mold illness flares, they're autoimmune tissue flares because this pocketed infection has been opened. And so your mouth can be a big source for inflammation in and of itself.
Mm-hmm. What are you mentioned C2 causing migraines? Okay. So like neck, back. So a lot of people go see an osteo, a chiropractor. What are your thoughts on that?
You have to individualize it. So some people can have migraines flared from tight muscles, from pinched nerves in the back of their neck. So definitely if you have like arthritis in your neck or you've got some malalignment, adjustments can definitely be helpful. Craniosacral, I don't know if they have craniosacral. And
yes,
okay,
they do.
Yeah. So it's interesting how the lymphatic drainage of your brain, you have lymphatic drainage in the brain. Actually, University of Virginia, that's where they discovered it several years ago, the glial lymphatics, and some people, particularly people that are hypermobile, have poor lymphatic drainage of their brain. So cranial sacral maneuvers can actually help improve the drainage of these. And ultimately, the glial lymphatic is important for removing toxins from your brain, especially when you're in deep sleep, restorative sleep, which is in the association with sleep and brain inflammation detoxification. If you don't get that deep sleep, you don't have as much movement of the glial lymphatics detoxifying your brain. And so that's where cranial sacral can help with that as well. And I actually have some patients that works really nicely for some of their, it's typically my hypermobile patients with myofascial issues and a whole host of things. Acupuncture as well can be another thing. My acupuncturist, she's like, when I have a headache, I put my needles here and it goes away. I'm like, I'm not putting needles in my face, but awesome for you.
That's amazing. Yeah, I've heard that too. So in regards to nutrients or minerals or vitamins or anything, what can an individual be mainly deficient in for them to be able to maybe suffer a migraine? Is there such a thing? Like when you hit a deficiency of something, it could cause a migraine, or maybe not indirectly. Have you come across that?
Absolutely. Well, there's two major things to think about. Fatty acids. If you have the abnormal fatty acids, omega-3s and 6s, phosphatidylcholine, these are the things that actually make the insulation or lining of your neurons and ultimately compose most of your brain mass. So high doses of omega-3s, for example, have a huge anti-inflammatory effect. But there's also then magnesium. It was really interesting. In America, 40% of Americans are magnesium deficient by blood test. Now, you got to remember that the minority, a small fraction of magnesium is in your blood. It's in tissues. So there's actually a salivary magnesium test you can do. It looks at tissue levels. 80% of Americans are magnesium deficient when you do the salivary test. So, and so low-grade magnesium deficiency can increase your incidence of headaches and migraines. It actually lowers your headache threshold. And it's kind of interesting. In 1996, when I started my training, my medical training, a long time ago, I know, but we were actually using IV magnesium in the ER to treat people coming in with acute headaches, high blood pressure. You're in preterm labor and your uterus is contracting. IV magnesium sulfate. It's cheap, easy to access, easy to use, pretty safe. Works great. So magnesium is one of those key nutrients. Omega-3s. There's a whole host of things: riboflavin, thiamine, other B vitamins, things you can do at night like melatonin, et cetera. A whole host of things. Certain herbs can be helpful as well. But I would say that if I was to pick, and if you ask me this question a month from now, I might give you another two, but I'd pick, your fats, especially your omega-3s and magnesium as the two key nutrients. And then of course, vitamin D. I don't want to forget vitamin D. It's amazing how many people with chronic pain issues, have low D, and D actually helps modulate neural sensitivity. Like, do your nerves pick up pain if you have low-grade inflammation? So. Again, vitamin D. Let me ask you a question. Yeah. How common is vitamin D deficiency in Australia?
How come it's a vitamin D deficiency in Australia? Because all we do, the average Australian is at home, jumps into their car or public transport, goes to work in an office, eats lunch in their office, then jumps back in the car and comes home. Okay. And most of the individuals, I guess, I know I'm talking, spend outside maybe on the weekends.
Okay, so it's probably pretty common there as well, I guess. Then.
But yeah, most Australians, actually a year and a half ago, 2 years ago, the general practitioners stopped doing vitamin D as an annual test because they said, oh, you're deficient, it doesn't matter. You're most likely deficient. That's my understanding. I would like to look at maybe some research and figure out why. It may have to do with genes, the VDR gene. I'm not 100% sure. Maybe most individuals carry that from our ancestors. Yeah, I'm not 100% sure, but that would be my guess.
Okay. Yeah. Well, the thing is, inflammation can drive vitamin D deficiency as well. There's some interesting data on high inflammation. Your body actually chews up your vitamin D just like it chews up vitamin C. Smokers need 4 times more vitamin C, for example, to maintain their C levels. Diabetics, people with poor oral hygiene have low D levels. So it's poor diet, not enough outside time, and low levels of inflammation. As far as causes of low D. And then you have the genes like VDR, the TAC, the FORK, there's mutations where it's like you have adequate serum levels, but it's not actually working. And then you have the whole 125 versus 25. Some people might have low 25 vitamin D, but if you check the 125, it's actually high, which means their body is actually shifting it towards the active form because of other things. And so that's where that vitamin D it's a little complicated sometimes.
Yeah, it is 100%. And what are your thoughts on vitamin D supplementations? Because I've read some new things coming out saying that it might not be as beneficial. And some people are saying, no, 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 you need to take it. I mean, look, end of all, safe sun exposure, like you say, always 100%. What are your thoughts on that?
I mean, I think it's like, I just go back to the calcium story, right? 15 years ago, every woman should take calcium, blah, 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 blah. Oops, we just gave a lot of women calcifications in their coronary arteries by just giving them gobs of calcium. Why is that? Because they consume the calcium. And for calcium to do what it needs to do, go to bones or wherever, you need vitamin D, you need vitamin K2, MK7, right? And so it's not just getting enough D for calcium to go where it needs to go. You also need your vitamin K. Well, you also need magnesium, phosphorus. And so I think I think many nutrients are the same story, like vitamin D. Taking it with your other fat soluble vitamins. There's great data looking at calcification in your carotid arteries. Vitamin K2 actually helps get calcium out of your carotid arteries. So I think taking fat soluble vitamins together, which is one of the reasons why when I do D, I'll do it with A and E and K as well. I keep them balanced, but ultimately I'll treat people to the level. So if your D is low, I'm going to give you D. Some people are worried about getting too much K2 and getting clotting issues because there's a concern with excess vitamin K, but it appears that K2 is not something that does that. But I still try not to give more than 200 to 300 micrograms of K2 if I'm giving someone a D. So that means if they're doing like 10,000 units a day of D, which I have a lot of people doing that, then I might do the first 5,000 with K2 and the next 5,000 without. So
yeah, that's an interesting one. So yeah, we were talking about, different minerals, vitamins, and so forth. So I've read a lot of studies, like you said, riboflavin, B2, magnesium, even CoQ10 for migraines, and even feverfew herbs and all the stuff that you mentioned, omega-3 and all these other things. And I guess you've answered the question in regards to what minerals and vitamins would you believe vital. So I'm guessing from pulling out what you said, it would be the omega-3, it'll be the magnesium, and it'll be the vitamin D, the key three ones today.
Yeah, today, exactly. But I think it's also, if I was to pick one thing to do well, to be honest with you, that's made a big dish with help with some of my complicated patients has been their diet. Figuring out food triggers, whether chemicals in their foods. And then my more complicated patients, it usually is like something, maybe they have chronic Lyme they don't know about, or Epstein Barr, or maybe they've got mold in their environment. They don't know that they have chronic inflammatory response syndrome, which is, the mold biotoxin illness. So it's just kind of walking through like the basic migraines, more complicated, and just figuring out the different tiers and what you can do for people. And then in the integrative and functional medicine world, we have tons of tools. It's not just the medications, right? So that's what I kind of love about migraines, because I feel like we've got so many cool tools, even like things like low-dose naltrexone. If you're familiar with that, I was talking with the local spine surgeon here in town last week, and they're like, it was about a mutual patient with some pain issues. And I was like, well, he's an older guy in his 90s and you don't want to give him anything crazy. And I was like, well, we could always try some low-dose naltrexone. And the guy was like, I've read about that. Do you actually use that at all? I'm like, all the time.
Yeah, wow, that's amazing. So let me go through an example of an individual. Let's talk a little bit about hemiplegic migraines, so stroke-like migraines, right? Can you explain to us what these are and how these are different to actual migraines? So I've got there's an individual that started having these hemiplegic migraines with aura and stroke-like symptoms on the one side of the body at the age of 12, family history of migraines from the mother's side. And this individual has ended up in hospital a number of times throughout her life, once, twice a year. So from your experience, what are your thoughts on these?
I mean, my personal opinion is, it's a spectrum. You've got people who have chronic sinus infections and neck pain that are migraines. You've got the typical people with a migraine, once or twice a year. You've got like me, that I used to have terrible migraines in college until I realized that it was basically pasta and raisin brains, like basically gluten was. And you got the people who literally, every time there's a weather change, they have these crazy headaches. And then on top of that, you've got the people who have like that constriction phase I was telling you about is so severe, you actually lose blood flow to one of your spinal tracts, part of your body. You lose your vision, you have a stroke-like migraine. And so those people always initially get a workup for a stroke. They get the carotid ultrasounds, the MRI, MRA, brain MRI, all that kind of stuff to make sure it's not like a stroke or some weird anatomical thing. And then they get the diagnosis of the stroke like migraine. But I think those people, it's more of an issue of severity. So if you have a young 12-year-old, did it start had they just started having their cycles, for example? It's one of the things to think about. Did it start when they're going through menopause? Is there a hormonal component to this? Because hormones affect vasoconstriction, 12-year-olds, is there anything else going on? I think about, to be honest with you, at that age, because people are supposed to be pretty healthy. I'm thinking diet, I'm thinking gut, and I'm thinking, is there anything in the environment like mold? You start going down those pathways. You obviously rule out all the bad stuff that can permanently disable someone. And then you kind of go back to the usual stuff. But it tends to be when people have these more severe forms, there's something more severe going on, and it might be you have to treat these 5 things,
Yeah.
I've even seen kids with pediatric sleep apnea. They've got allergies, big adenoids, tonsils, they snore a little bit, and they actually have kiddie sleep apnea that's actually affecting their headache threshold. So there's all kinds of things you got to look at. And again, we have a big toolkit that we can look at. So
yeah, no, 100%. And you did mention, I spoke about Epstein Barr virus and viruses and viral infections. How would they impact individuals with migraines?
If you look at chronic infection, well, take a step back. The average person, and has about 10 active viral infections in their body at any given time. It's like the normal thing our immune system is supposed to do is ignore the stuff and it passes on. What can happen with something like Epstein Barr is it gets into this smoldering phase. You can't clear it, you can't suppress it, and you get activation of your innate and you can't lead it to your adaptive immune system. So that's where Epstein Barr can lead. There's the association with chronic EBV and MS, Hashimoto's, a whole host of things, chronic fatigue syndrome. And so, so you can get this low grade neural inflammation. And that's where also like genes are so interesting. Like one person can have, chronic Epstein Barr and they've got MS, one's got Hashimoto's, one's got chronic fatigue, and someone else has like just chronically swollen lymph nodes. The same thing, but in the different person, different environment. And that's where just kind of like unwinding that a little bit. But the EBV just causes low grade inflammation and just is chronically stimulating your immune system. And so in some people, that's going to cause chronic pain syndromes, fibromyalgia, chronic fatigue, other neuroinflammatory disorders, and migraine. How many people with migraines have chronic fatigue and fibro and push crash phenomena and hypersensitivity to their body and weird pains moving around their body? And the answer is a lot. And then, all of a sudden they have neural inflammation,
100%. So in addition to my understanding, one of the key things to support when individuals have migraines or headaches, especially with the studies with the CoQ10, would be mitochondrial function. What are your thoughts on the effects of mitochondrial function on these headaches or migraines?
Mitochondrial, the more and more we learn, probably mitochondrial function or dysfunction is at the base of pretty much all chronic diseases, including cancer. Actually, uncoupling of your electron transport chain is actually what gets your cells to switch from a typical metabolism to this anaerobic metabolism, which is what happens with cancer cells. And it's an uncoupling of their mitochondria. Most chronic health issues, we're actually finding out that actually mitochondrial dysfunction, the mitochondria, one of the things about the mitochondria that are cool is that they help, if a cell's healthy, and you have that massive, cool, healthy mitochondria, they split, and you actually get more healthy mitochondria. If you have 2 sick mitochondria, they'll actually fuse together and make a healthy one. But when you get this thing called cell senescence, which is where your cells get sucked, they can't turn over. Autophagy, the idea that your cells are turning over, they get senescent, they get stuck. This is a proliferative inflammatory condition. And we're finding out that my understanding, it started in the mold world, where this is one of the major things with chronic fatigue and fibro and all the neurological issues with mold. We're actually realizing it's related with cardiovascular disease and Alzheimer's and a whole host of things. So, mitochondria are kind of, maybe they're at the base of, not just life, but everything else, right? And so that's where all these nutrients we're mentioning, omega-3s, fats, magnesium, B vitamins, CoQ10. Wait a second. These are all part of complex 1, 2, 3, 4 in the electron transport chain that make energy. And the one thing that's interesting is that your body, on average, creates about 8 times your body weight every day in ATP. Just think about that. I weigh about 173 pounds. So I'm making 173 times 8 times my body weight in ATP every day. If the efficiency on that is reduced 10%, I won't die, but it's going to affect all my body systems. It's almost like thyroid hormone. Your thyroid is this minuscule little thing, right? You take your 50 micrograms, which is almost nothing, but if it's off, it messes up everything.
Yeah, 100%. I loved how you explained the mitochondria. And like you said, all those supplements or those minerals that we spoke about, they assist our mitochondria to function. So it's kind of like, and all those toxins like mold, food toxins, they affect our mitochondria, right? So it's a very interesting way to look at it. The thing that I wanted to ask you is, I probably don't know how to pronounce this, palmitoylethylamine, P, we call it PEA, right?
Yeah.
PEA. So it's used here in Australia. It got approved, I think, about 2 years ago.
Is it approved as a drug or as a supplement?
As a supplement. It's been approved in Australia as a supplement. And a lot of naturopaths use it to assist people with their pain. And then it's been also looked into putting that under your tongue for individuals who are about to get a migraine. What are your thoughts on that?
I mean, that is another supplement that affects nerve function. It's associated with neuronal function, neurotransmitter production and function. You look at PA, you look at PMT, there's a whole host of these things. We don't use it a lot here in the United States. It's just kind of hard to source well. So if you've got a good source, that's a big thing. But it's one more thing just that recognizes that there's a biochemical process, and you can kind of stick your little things in there, and that can work for some people. And it's just one more tool in the toolkit. It's not just like magnesium is not the answer for everybody. PEA won't be the answer for everybody. There are some concerns with purity with PEA if with the sourcing, which I think is the bigger issue. It's almost kind of like chlorella, and spirulina, great things, but actually blue-green algae are one of the things that can cause chronic inflammatory response syndrome. And if you're making your blue-green algae in a bad environment, you can actually give people toxins. And so like where I get my chlorella from is this place in Japan on this mountain that's really cold. So it minimizes that. So just like when you're sourcing something like that, you just got to make sure you're getting it from a good place. And I think that's, that'd be my take home with that particular one is getting it from a good source, reliable source. And that, if you're recommending I usually will track down like the certificate of analysis and just say, can I verify this product? If a collagen producer won't give me their certificate of analysis that they don't have lead in their collagen, right? I'm not going to recommend it to patients,
Yeah, 100%. And I think that's got to do with also like the B2, the CoQ10, the magnesium that we spoke about, the omega-3, what source that is. On the omega-3, I forgot to ask you, fish oil versus algae, and I guess on this topic about, toxicity and so forth, what are your thoughts?
Conceptually, algal oil should be fine. The problem is it's mostly, and krill oil as well, but they're mostly solvent extracted. And so it's one of those things, one, how are they extracting it? The second thing is dosing. How do you get enough EPA and DHA? You look at—
You're taking about 10 tablets.
Well, exactly. Yeah, you're taking a ton. So if you look at the literature, let's say you're a rheumatoid patient. I'm like, well, some studies look at 5,000 milligrams a day of your omega-3s can help with, it showed like actually in this one study was almost as effective as methotrexate for rheumatoid patients. How many algal oil capsules is that? Like probably 30. I mean, a ton. And so I think
the whole bottle.
Yeah. And one of the things as well with some of those things like algal and krill is like the way they actually get it, particularly krill, for example, it's really terrible in the environment. It's like the way they get it's really bad. And it's not as sustainable as like a fish or small fish product. I feel like I can actually control the quality a little better on that. And just dosing. When you look at studies for omega-3s, the doses are pretty high, and like, so maybe some people say, well, this is a more bioavailable omega-3 and you get more in the cell. I'm like, well, that's cool. Let me give some studies so I can look at that and verify that. So, I feel like I've got some, I've been able to source pretty good quality forms of omega-3, but omega-3s are tricky because they're unstable. And so if they get heated, they go rancid, they break down. A lot of omega-3s are actually heat extracted. I prefer things that are CO2 extraction or molecular distillation to make sure it's clean. Is it put in a brown glass bottle, right? If I buy nice olive oil, It comes in a brown glass bottle. Why? Because the UV light breaks down my omega-3. And broken down omega-3s become rancid oils, which are toxic.
100%.
So it's kind of like something that's supposed to be healthy. And that's where it gets tricky, right? Something that's supposed to be healthy now is not.
Yeah.
And
a lot of people fall into that trap, don't they? Because a lot of people come in and they're like, I'm eating so healthy. I'm doing such healthy things. And I'm like, oh, I'm so sorry to break this to you. But this, I know you spent $50 a bottle on this. How about go on to this one, what, like you said, that is in a brown bottle, that's glass. And also where you store it. Are you storing it above where you're cooking, where the heat comes?
Yeah.
It's so many things, isn't it?
Well, I have one of my patients actually, just to that point, like came in this past week and was like, you recommended this, supplement to me. But I found this other one that's special for hormones for women, because women hormone thing, it sells, right? And that was a nice, beautiful, clear plastic bottle. And the capsules had these really cool little pellets in there. I'm like, well, the stuff I recommend to you see this glass brown bottle? You see it's clear. And I explained to them how, basically this is protecting your product. This is not. And you can see the light bulb go on. They're like, oh, but this looked really cool.
Yeah.
Yeah, a really great website. And so they got it.
Yeah, it's so interesting. There's so many things we take in consideration. So before we, I guess, wrap up and talk about a few things that we can do for individuals who may have migraines, just to wrap it up, there's two things. We spoke a little bit about immune system. So with the viruses and things like that, let's talk a little bit about sleep and migraines, right? So I see individuals who come to see me who have headaches and migraines. Their circadian rhythm is off track totally. They're not sleeping at night. They don't get tired until 1, 2 a.m. And it's been like that for most of their life. And then they have to get up for work at 7 or 8 because that's what, our world doesn't favor the night owls, unfortunately for them. But how would sleep and headaches and migraines or even neuroinflammation be affected?
Well, I mean, the whole thing with sleep, that's when your brain does most of its detoxification. It's when your hormones reset. It's when your cortisol comes down. It's when your melatonin is a huge brain anti-inflammatory. It's when those levels go up. And so there's so much stuff associated with that. I mean, I mentioned before, literally sleep deprivation lowers your seizure threshold. Now, this is one study, and you can only do this, with military recruits, but they had military recruits, a bunch of guys back in the day, and they sleep deprived them for 2 weeks to see what happened. About 2 weeks, they basically all went mad, basically. And sleep is super, super important, and so it's they got their sanity back. It was just a slight craziness. So nothing long-term, right? But the point being is that sleep is so critical for everything. It's like, I have this thing I call my triangle of health. It's like, what are the 3 things everybody's got to do well? That's your gut, which food, stress, and sleep. And it's like, and if you look at blue zones, places where they do these basic things well, there's one area, actually a Polynesian area in the Pacific. 80% of the males smoke. No increased risk for heart disease or cancer. They eat what they can catch or kill, close family communities, small little, I think it's like 3,000 people on the island. And it's like, literally lifestyle is so powerful that can abate smoking. The French paradigm, they drink wine, they smoke, risk for heart disease is lower than Americans. Why is that? Because of these real food and the closeness of society and just these stress reduction. So these things, stress, sleep, your gut health, and sleep is so critical. And so many people have issues with it. And so many people have sleep apnea, so if you can't get your sleep straight, it's gonna be hard to control brain inflammation, gut inflammation, autoimmune diseases, hormone issues. I mean, what does sleep not affect?
And talk about lifestyle things like that. Exercise, like the research that I have read on migraines and exercise has been extraordinary. And I'm guessing that's got to do, with the oxygen going around, with mitochondria, increasing the mitochondria in your body with exercise. Have you seen anything or read anything with exercise?
Well, I think exercise is also, it's like one of the best anti-anxiety medications. It burns off excess cortisol. It burns off excess norepinephrine, adrenaline. It helps prepare you for sleep that night. Think about kids, right? The day the kids are running around a lot, they sleep amazing that night, right?
Me too.
Yeah. They're like inside all day long. The bad days, those nights, they're up late. Why? You need that physical activity for your body to work the right way. So I think, physical activity is one of those things that it helps with sleep. It helps with stress. Those things are all going to play into headaches.
Yeah. Wow. We've just covered so much in such a short period of time. And I guess the audience got a little bit of a detail about migraines and what they can do and so forth. But I thought, let's wrap it up. Let's talk about, I know everyone's case is individual and this is not medical advice. And, you should talk to your healthcare professional before you take anything on. So 3 things acutely that someone can do and 3 things prevention wise that individual can do. What would be some things that comes to your mind?
Well, acutely, if you're at home and not at the hospital, would be taking an oral anti-inflammatory of some sort, an oral antihistamine of some sort, and caffeine. Caffeine, it's like caffeine's in pretty much every migraine thing, butalbital, et cetera, Advil, migraine, et cetera. And so taking those in significant doses can break that initial migraine. I've kind of, moved on. Personally, I'll actually take a high dose of magnesium now. So I'll take about 700 or 800 milligrams of magnesium, which means I'll have a loose bowel movement the next day, but it does a nice job. And I'll do that with aspirin, like a Bayer aspirin, which is actually, its copyright is from the 1950s. So it's got 4 ingredients. It's funny, in America, Whole Foods does not have ibuprofen because it has all these fake stuff in it. But they have aspirin because they have Bayer aspirin because Bayer aspirin is they got 4 things in it. So that's you're out. If you're in a doctor's office, you can do shots of Benadryl, shots of Phenergan with Toradol. Some of my more difficult patients have actually done dexamethasone or steroid shots with Benadryl or Toradol. I definitely do not do any opioids for headaches because all you do is create a rebound headaches. The problem with these medications, if you use them more than 3 to 4 times a week, you can create rebound headaches. And a lot of people with chronic headaches, they're rebound. So if you're taking an acute medicine like that more than 3 or 4 times a week, you might have rebound headaches. So that's something to keep in mind with your audience. The other thing is that with prevention, your diet is huge. Like I've had so many people doing just a basic elimination diet, removing nightshades, removing histamine foods, just doing that as a starter. Sleep, you got to work on your sleep long-term. And then the question is there anything in your environment that's triggering this? Is there mold in your environment? Do you have other things going on? Chemicals. It's really interesting. In our home, we did our house and we don't have any laundry detergents and fabric softeners. And it's interesting. Someone comes to my house and I can smell them as they come in the door from the fabric softeners.
Me too.
It's just crazy. Yeah. It's just it's like, oh my gosh, don't you all smell that? And oh, smell what? I'm like, oh my, and it lingers. We had a young lady stay at our house 2 weeks ago, just overnight. And the smell of the fabric softener was in our downstairs. She was upstairs for almost a week later.
Wow.
So think chemicals, cleaning stuff. The average female in America puts over 200 chemicals in her body every day before she leaves the house. So what are your personal hygiene products? And I think that's where a lot of women, not only do they mess up your hormones, they're called neuroendocrine disruptors, but they also can be neuroactivating or stimulating. So I think those are some basic things to think about.
Yeah, 100%. There's so many things check out your diet, check out your sleep, check out the toxins around you.
Yeah.
And if you clean, you got toxins around you. If you put on makeup, you got toxins around you. If you wash your hair, you got toxins around you. Literally so many things. And we didn't even touch base on the EMFs and so forth and all those other things around us. There's so many things, but we're coming to the end of the podcast. And I really, really do appreciate your time and sharing this information because I know that you have a soft spot for migraines and helping individuals with that. So Aaron, thank you so much for joining us on a Natural Health Podcast. Is there anything else that you want to say before we let you go? Or
I just think, if you're dealing with migraines, really bad headaches, they've been chronic, there are answers. You can get to the bottom of it. Just find someone you can work with that can help. If you took notes on this and you wrote things down, and you take them to your provider and they have no idea what the stuff is, and you need to find someone else. Medications work for a lot of people, but a lot of people, they need more than just medications. They need lifestyle. And that's where just finding someone that can, that's sometimes having someone who's had headaches and migraines, you need that because they've gone through the ropes. And so, and again, and personally as a physician, I've had really good results. There's been very, very, very few patients I haven't been able to help with migraines. I know I'm in America, so it doesn't help your Australian, but people, but there are people out there that are really good at that. And if not, just find a coach, find a nutritionist, find someone that can help walk you through some of these things. Because most people with migraines, there's something else. It's not a Topamax or deficiency, or a dexamethasone deficiency, or a, Imitrex or Maxalt deficiency. There's something else triggering these. And so finding that root cause can be super, super helpful.
100%. Thank you. Thank you so much, Aaron. Thank you for joining us on the Natural Podcast. And remember, the missing link between failure and success is your health. Content and information provided here is opinion of Mahela Raguse and is for information purposes only and does not constitute medical advice. It is not intended to provide medical advice or take the place of medical advice or any current treatment you're undertaking. Consult your own medical professionals for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the Natural Health Podcast. It is advised that you consult your doctor or healthcare professional in relation to any health concerns you may be having. Mahela Raguse does not take responsibility for any health consequences which occur from a person listening, viewing, or reading this content. And in no circumstances shall the Natural Podcast, Mahela Raguse, any guests or contributors to the Natural Podcast, or any employees, associates, or affiliates of Mahela Raguse be responsible for damages arising from the information provided on the Natural Podcast. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical conditions in either yourself or others. Please note, if you're taking prescription, do not stop your medication or start a new protocol, including but not limited to supplements, diet, lifestyle changes without consulting your doctor or healthcare professional. If you or any person has a medical concern, you should consult with your healthcare provider or seek other professional medical advice. Never disregard professional medical advice or delay in seeking it because of something that you have read or heard on the Natural Podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. Neither Mahela Raguse nor the publisher of this content takes responsibility for the possible health consequences of any person or persons reading or listening or following the information in the educational content.